Hello, everyone, and how was your exam? I'm Dr. Anupama C, Devgan, your physiology faculty at Allen Next. And we are going to discuss the physiology questions, relatively simple questions, very, very doable. And we will go through all the options and all the answers. Now, firstly, let me see. How was the exam? That is important. So let's have a feedback from you. And meanwhile, I'll start with the first question. Now, this is a relatively simple question. So many times we have been talking about it in the PYQs, in the lectures, and that is action of thyroid hormone is mediated by which receptors. Now, firstly, remember, thyroid is one of the lipid-soluble hormones. Lipid-soluble hormones are the steroids and thyroid. And lipid-soluble hormones have either cytoplasmic or nuclear receptors. And which are the ones which have got nuclear receptors? The way to remember this, like I normally tell you, remember date. Easy to remember. So vitamin D, vitamin A, thyroid, and estrogen. These are nuclear receptors. And sometimes I'm asked this question that T could also be testosterone. And then I tell you that please remember date with a hypothyroid woman. So maybe that is a way to remember what are the ones with nuclear receptors. All the other lipid-soluble hormones have cytoplasmic receptors. And when I talk about the other lipid-soluble hormones which have got cytoplasmic receptors, that would mean glucocorticoids, aldosterone, testosterone, and progesterone. So these are your nuclear and cytoplasmic receptors. Simple question, has been discussed a number of times, and hopefully all of you got this right. Let's go on to the next one. Two medical students are planning a trip to high altitude, to some place in high altitude. I could think of Leh Ladakh. They want to study the effects of acclimatization high altitude. Which one of the following changes will not be seen? Will not be seen in high altitude during the process of acclimatization. Will there be an RBC increase in RBC count? Yes. So what happens is in high altitude, there is what is known as hypoxic hypoxia. Because of the decrease in the atmospheric pressure, the partial pressure of oxygen reduces. There is a decrease in the partial pressure of oxygen, which results in a hypoxic hypoxia. Now, whenever there is a decrease in the partial pressure of oxygen, it is a very potent stimulus for the secretion of erythropoietin from the kidney, mainly from the kidney. And what is the role of erythropoietin? Erythropoietin increases the red cell mass. Erythropoietin acts on the committed stem cell stage and decreases what is known as apoptosis. If it reduces the apoptosis, what is apoptosis? Programmed cell death. It reduces or suppresses the apoptosis. So committed stem cells produce more and more RBCs. So it increases the red cell mass. And remember, what is a very important stimulus for the secretion of erythropoietin? Decrease in PO2. So there will be an increase in RBC count. The second option is there going to be increase in capillary density, which is also true. Because there is less PO2, because there's a fall in PO2, this stimulates angiogenesis. That means formation of new capillaries. So it increases the capillary density. What is the advantage? Advantage means a better blood flow to the tissues, so that tissues can utilize more oxygen, or tissues can get more oxygen. Is there going to be increase in myoglobin? Which is also true. What is myoglobin? Myoglobin is a pigment present in muscles. It is a storehouse of oxygen. In conditions where there is less oxygen, I will increase myoglobin in the muscles so that I have more oxygen stored in the muscles. Is there going to be a hypoventilation? Absolutely not. In fact, what is going to happen in high altitude is a hyperventilation. Whenever there is a decrease in PO2, it will stimulate the peripheral chemoreceptors. Which are the peripheral chemoreceptors? The carotid and the aortic bodies. And these will increase the rate as well as the depth of ventilation. And this results in an increase in the total or pulmonary ventilation and increase in the alveolar ventilation. And whenever there is increase in the rate and depth of ventilation, we call it hyperventilation. So what you're going to see in high altitude is a hyperventilation, right? So the answer to this question is going to be D. Let's look at the next question. Now, there are two versions of this question. I will tackle both. One recall says that glucose is mainly transported by GLUT2 in which of the following sites? Now, GLUT2 will be present in the small intestine, in the kidney, in the liver. So it's present in all the three areas. So then how do I choose which is the correct answer? Now, in the small intestine and the kidney, the GLUT2 is present on the basolateral membrane. So let's try and understand what is the basolateral membrane. So if this is the PCT as well as the intestinal epithelial cells have a brush border, microvilli, present towards the lumen. The glucose transporter on the luminal side in the PCT is mainly SGLT2, sodium glucose linked transport 2. Sodium glucose linked transport 2, which is an example of secondary active co-transport. And on the basal side, the glucose will leave the cell via GLUT2. 90% of glucose is absorbed in the PCT in this fashion. Secondary active co-transport on the luminal side, and once the glucose reaches the cell, it leaves the basal side via GLUT2. In the case of the intestine, similar mechanism for absorption. So you have the SGLT1 on the luminal side, again a secondary active co-transport, and on the basal side you have GLUT2. But what about the hepatocytes? As far as the hepatocytes are concerned, they have only GLUT2. There is no SGLT there, they have GLUT2. Glucose will enter from the blood into the hepatocytes via GLUT2. So the best answer in this case is the liver. Liver has only GLUT2, whereas in the case of the PCT and the small intestine or the enterocyte, on the luminal side, there is the sodium glucose linked transport. Now, there is another version of this question. It says, which of the following glucose transporter is present on the basolateral membrane of the intestinal epithelial cell? In that case, it's a very simple straightforward. The answer is GLUT2. So there are two versions of this question. I'm not sure which is the one which has been asked because two sets of people have given these two different questions. If it says which is the glucose transporter present, then your answer is SG on the basolateral membrane, or also sometimes called the contraluminal membrane. That means opposite to the luminal membrane, and that will be GLUT2. If one of you could tell me which was the version of the question, the first one or this one, then probably we will be in a better place. All right. Let's see. In the adjacent graph, phase 1b represents which one of the following properties of smooth muscle of the urinary bladder. Now, this is a cystometrogram, which we do in all our classes. So, cystometrogram. Okay, so Vivek has given me an answer saying it is the second. It is this question which was asked. So this is a straightforward question. Basolateral membrane, GLUT2. I hope you got it right, Vivek. All right. So let us look at the cystometrogram, and you've got the intravesical volume on the x-axis and the intravesical pressure on the y-axis. And we find that initially, as the bladder fills up, there is an increase in the intravesical pressure. Then in phase 1b, what is happening is there is an increase in the intravesical volume, but no or relatively less increase in the, or almost no increase in the intravesical pressure. This is because as the bladder is getting filled up, it tends to distend. Now, which is the property of the smooth muscle which is reflected in phase 1b? This is plasticity. Smooth muscle is a plastic structure, moldable structure. You know, it's something like plasticine. So that is what is it's a plastic structure. As the urinary bladder is getting filled up with urine, it tends to, the smooth muscle of the urinary bladder, the detrusor, tends to relax. So that is what is known as plasticity. And in phase 1b, which is the law which is applicable, that is called the Laplace's law. So this is 1b is plasticity. Now what happens in phase 2 when the bladder volume reaches 400 ml? Now there is a contraction of the detrusor muscle. And this is what is responsible for the evacuation of the bladder. So phase 2 will represent contractility. Contractility. So the answer to this question is plasticity. So Vivek says, why not elasticity? Now, what is elasticity is? Elasticity is, for example, elastic will be like a rubber band. You stretch it, there is a tension which is generated, and then it will tend to recoil to its original size and shape. Like, for instance, when we talk in terms of blood vessels, like the aorta, the large arteries, these are elastic vessels. In systole, they tend to expand, but during diastole, they tend to, because of the elastic recoil, they will squeeze the blood and push it forward. Now, the smooth muscle shows the property of plasticity rather than elasticity, right? So the answer will be plasticity. Okay. Remember this, the urinary bladder has plenty of smooth muscle, not elastic tissue, right? So the answer to this question is plasticity. Now, Dr. Ikra says another question was nerve of pain conduction. This, if the question says nerve of pain conduction, which is it going to be? The options were A alpha, A beta, A delta, and C. Then my answer is C. Of course, then I can be asked this question that A delta is meant for fast pain, C is meant for slow pain. Please understand that A delta, even though it carries fast pain, what is the role of fast pain? Withdrawal reflex. You touch something hot, there is a sharp pain which you feel, which is carried by A delta fibers, which makes you withdraw your hand. So that is fast pain. But pain due to tissue injury, because your hand has got burnt, the pain is carried by C fibers. So the pain that you feel is because of the C fibers. So better answer will be C. If this was a question, Dr. Ikra, then your answer is C. Fantastic. A delta, Pavan, will be for fast pain. If the question said fast pain, then A delta. But if it says only pain, then my answer, better answer is C. Okay, let's see the next question. Serosa is not present in which of the following? Now, this is actually more of an anatomy question, more of a histology question, but the answer is esophagus. Esophagus, right? Okay, all right. Identify the hormones A and B responsible for negative feedback on hypothalamus pituitary axis. Again, a question that we discuss very frequently. So let's try and see this. Now, remember LH, and the receptors for LH are present on the Leydig cells, and Leydig cells are responsible for the secretion of testosterone. FSH receptors are present on Sertoli cells. FSH in FSH and Sertoli cells. And Sertoli cells will secrete inhibin. Inhibin has a negative feedback effect on the secretion of FSH. Testosterone has a negative feedback effect on the secretion of LH and GnRH. What about testosterone will in fact has a stimulatory effect on the Sertoli cells. So this is the regulation of the male sex hormones. So the answer here, if A is given on the right side, so this was inhibin and B is testosterone. So this is my answer, inhibin and testosterone, right? Remember, LH receptors on Leydig cells, FSH receptors on the Sertoli cells. Sertoli cells secrete inhibin and the Leydig cells will secrete testosterone. All right, let's look at the next question. Again, something which has been covered in all the lectures on IV injection of an irritant substance. There is bradycardia, there is hypotension and apnea. This represents which of the following reflexes? Now, this is the Bujold-Jarisch reflex, or also known as the coronary chemo reflex. And what is this reflex? Whenever there are irritant substances such as serotonin, capsaicin, veratridine, phenylbiguanides, when these are injected, into the coronary arteries, or this will result in a hypotension, bradycardia and apnea. Here the receptors are present in the left ventricle, right? So this is what is known as the Bujold-Jarisch reflex. There is a bradycardia and a hypotension along with an apnea. Now, what is a Bainbridge reflex? Bainbridge reflex is whenever there is a sudden increase in blood volume. This causes an increase in heart rate, not a bradycardia, it increases heart rate. And which are the receptors which are responsible for the Bainbridge reflex are what are known as the atrial stretch receptors. And what is the Cushing's reflex? Cushing's reflex is seen whenever there is an increase in the intracranial pressure, which causes whenever, let's say, if there is a head injury or some sort of a intracerebral hemorrhage, which has increased the intracranial pressure, it compresses the cerebral blood vessels, it causes a CNS ischemia, and there is an increase in sympathetic discharge, which causes an increase in blood pressure, but because of an intact baroreceptor mechanism, there is a bradycardia associated with it. This is called a reflex bradycardia. So there is an increase in blood pressure and a reflex bradycardia. It will also be associated with irregular respiration. This is also known as the Cushing's triad: increase in blood pressure, bradycardia, and irregular respiration. This is what you see in the Cushing's reflex. So my answer is, if there is a bradycardia, hypotension, and apnea, then my answer is the Bujold-Jarisch reflex. Okay. So this is as far as the questions are concerned. Any clarification, any question from your side, anything that I can help you with? All right, so these are the ones which were recalled. There must be more questions on physiology as I gather, but generally must have been easy, and that is why probably there are not too many recalls that are available to me. So any questions from your side? Anything from your side? Vivek, Cortex user? Anything from your side? Somi Ali, anything that you would like to ask? If not, then I'd like to wind up, and with my best wishes, with my blessings, I just hope each one of you does well in the exam. My best wishes for you to attain all your dreams. Yes, Nadeem. Okay, so these were the hard ones. Yes, these were relative, but the others which have not been recalled must have been relatively easy. Yes, thank you, Cortex, for all your interaction. Thank you, Vivek, Nadeem. Thank you very much. Thank you. And if there are no questions, I would like to wind up and see you all soon. Okay, with the news of some great results. Yes, okay. Thank you very much. Thank you.